Welcome. Today, we're diving into the topic of chronic kidney disease, often abbreviated as CKD. This is a long-term condition that affects how well your kidneys function. Kidneys play a crucial role in filtering waste and excess fluids from your blood. So when they're not working properly, it can impact your entire body. In this video, we'll explore what chronic kidney disease is, why it matters, and how doctors diagnose it. Let's start by understanding the basics before moving into the details of diagnosis and management. Your kidneys are two bean-shaped organs located on either side of your spine, just below your rib cage. They're responsible for filtering blood, removing waste, balancing fluids, and regulating blood pressure. Healthy kidneys are essential for overall well-being. When they're damaged, waste products and fluid can build up in your body, leading to various health problems. Understanding the role of kidneys helps us appreciate why chronic kidney disease is such a serious condition. Chronic kidney disease is a condition where the kidneys gradually lose their ability to function over time. Unlike acute kidney problems, which happen suddenly, CKD develops slowly and can go unnoticed for years. It's called chronic because it's a long-lasting, persistent issue. CKD is usually irreversible, but early detection and management can slow its progression and help maintain quality of life. CKD is classified into 5 stages, based on how well the kidneys are working. These stages are determined by a measurement called the glomerular filtration rate, or GFR. Stage 1 means there's only mild kidney damage, while stage 5 is considered kidney failure, where the kidneys can barely function. Understanding these stages helps doctors plan treatment and monitor disease progression. In the early stages, chronic kidney disease often has no noticeable symptoms. As the disease progresses, people may experience fatigue, swelling in the legs or ankles, changes in urination, and high blood pressure. Some may also have trouble concentrating or feel generally unwell. Recognizing these symptoms early can prompt timely medical attention and improve outcomes. Certain factors increase the risk of developing chronic kidney disease. These include diabetes, high blood pressure, heart disease, family history of kidney problems, and being over the age of 60. Lifestyle factors like smoking, obesity, and frequent use of certain medications can also contribute. Knowing your risk factors can help you take steps to protect your kidney health. Catching chronic kidney disease early is crucial. Early detection allows for interventions that can slow the progression of the disease, prevent complications, and improve quality of life. Regular checkups and screening are especially important for people with risk factors. The sooner CKD is identified, the better the chances of managing it effectively. Diagnosing chronic kidney disease involves a combination of medical history, physical examination, and laboratory tests. Doctors look for evidence of kidney damage and assess how well the kidneys are functioning. The main tests include blood tests to measure creatinine and estimate GFR, urine tests to check for protein or blood, and sometimes imaging studies. Let's break down each of these diagnostic tools. A key part of diagnosing CKD is a blood test that measures creatinine, a waste product filtered by the kidneys. High levels of creatinine in the blood can indicate reduced kidney function. Using this value, doctors calculate the glomerular filtration rate, or GFR, which estimates how well your kidneys are cleaning your blood. A lower GFR means poorer kidney function. Urine tests are another important tool in diagnosing CKD. Doctors check for the presence of protein, especially albumin, in the urine. Healthy kidneys usually prevent protein from leaking into urine, so finding protein can be an early sign of kidney damage. Sometimes, blood or other abnormalities may also be detected in the urine sample. Sometimes, doctors use imaging studies like ultrasound or CT scans to get a closer look at the kidneys. These tests can reveal the size, shape, and structure of the kidneys and help identify any blockages, cysts, or other abnormalities. Imaging is especially useful if there's uncertainty about the cause of kidney problems or if structural issues are suspected. During a physical exam, doctors may check for signs of fluid retention, high blood pressure, or swelling in the legs and ankles. They'll also review your medical history and ask about any symptoms you've noticed. This information, combined with lab results, helps form a complete picture of your kidney health. GFR stands for glomerular filtration rate. It's a calculation that estimates how much blood your kidneys filter each minute. GFR is considered the best overall indicator of kidney function. A normal GFR is typically above 90, while lower values indicate varying degrees of kidney impairment. Doctors use GFR to stage CKD and guide treatment decisions. Proteinuria is the presence of excess protein in the urine. It's a key marker of kidney damage. In healthy individuals, the kidneys filter waste but keep important proteins in the blood. When the kidneys are damaged, proteins like albumin can leak into the urine. Persistent proteinuria is often one of the earliest signs of chronic kidney disease. High blood pressure is both a cause and a consequence of chronic kidney disease. Damaged kidneys can't regulate blood pressure effectively, and uncontrolled high blood pressure can further harm the kidneys. Monitoring and managing blood pressure is a critical part of CKD diagnosis and treatment. It's important to distinguish chronic kidney disease from acute kidney injury. Acute kidney injury happens suddenly and is often reversible with prompt treatment. In contrast, CKD develops slowly over months or years and is usually permanent. Understanding this difference helps guide appropriate care and expectations. The most common causes of chronic kidney disease are diabetes and high blood pressure. Other causes include glomerulonephritis, polycystic kidney disease, prolonged use of certain medications, and autoimmune disorders. Identifying the underlying cause is important for tailoring treatment and preventing further damage. A family history of kidney disease increases your risk of developing CKD. Genetic factors can play a significant role, especially in conditions like polycystic kidney disease. If you have relatives with kidney problems, it's important to discuss this with your doctor and consider regular screening. Lifestyle choices can influence your risk of developing chronic kidney disease. Smoking, obesity, poor diet, and lack of exercise all contribute to kidney damage. Making healthy choices, such as eating a balanced diet, staying active, and avoiding tobacco, can help protect your kidneys and overall health. Some medications, especially when used long-term or in high doses, can harm the kidneys. Non-steroidal anti-inflammatory drugs, NSAIDs, certain antibiotics, and some blood pressure medications may increase the risk. Always consult your doctor before starting or stopping any medication, especially if you have risk factors for CKD. Chronic kidney disease is more common in older adults. As we age, kidney function naturally declines, making older individuals more susceptible to CKD. Regular screening and monitoring are especially important for seniors, as early intervention can help maintain kidney health and prevent complications. While less common, chronic kidney disease can also affect children. Causes in children often include congenital abnormalities, inherited conditions, or infections. Early diagnosis and specialized care are essential to support growth and development in young patients with CKD. Chronic kidney disease can lead to a range of complications, including anemia, bone disease, cardiovascular problems, and electrolyte imbalances. Managing these complications is a key part of CKD care. Regular monitoring and appropriate treatment can help reduce the risk of serious health issues. There's a strong link between chronic kidney disease and heart health. People with CKD are at higher risk for heart attacks, strokes, and other cardiovascular problems. Managing blood pressure, cholesterol, and blood sugar is vital to protect both your kidneys and your heart. Kidneys help regulate electrolytes like sodium, potassium, and calcium. In CKD, these balances can be disrupted, leading to symptoms such as muscle cramps, weakness, or irregular heartbeats. Monitoring and managing electrolyte levels is an important part of CKD care. Anemia is common in people with chronic kidney disease. The kidneys produce a hormone called erythropoietin, which stimulates red blood cell production. When kidney function declines, less of this hormone is made, leading to anemia. Symptoms include fatigue, weakness, and shortness of breath. CKD can affect bone health because the kidneys help regulate calcium and phosphorus levels. When kidney function declines, these minerals can become imbalanced, leading to bone weakness and increased fracture risk. Managing mineral levels and getting regular bone health checks are important for people with CKD. Diabetes is the leading cause of chronic kidney disease. High blood sugar levels can damage the blood vessels in the kidneys over time. Managing diabetes through medication, diet, and lifestyle changes is essential to prevent or slow the progression of CKD. High blood pressure, or hypertension, is another major cause of CKD. It damages the small blood vessels in the kidneys, reducing their ability to filter waste. Controlling blood pressure with medication and lifestyle changes is a key part of CKD prevention and management. Screening for chronic kidney disease is recommended for people with risk factors like diabetes, high blood pressure, or a family history of kidney problems. Screening usually involves simple blood and urine tests to check kidney function and look for early signs of damage. Early detection can make a big difference in outcomes. Doctors diagnose CKD when there's evidence of kidney damage or reduced kidney function lasting for at least 3 months. This can be based on abnormal blood or urine tests, imaging findings, or a combination of these. Persistent proteinuria or a low GFR are key diagnostic criteria. Chronic kidney disease often progresses slowly. Regular monitoring helps track changes in kidney function and detect any complications early. Doctors may adjust treatment plans based on how quickly the disease is advancing, aiming to slow progression and maintain quality of life. A nephrologist is a doctor who specializes in kidney health. They play a key role in diagnosing and managing CKD, especially in more advanced stages. Nephrologists help develop treatment plans, monitor disease progression, and coordinate care with other healthcare providers. Patients with CKD can take an active role in managing their health, monitoring blood pressure at home, keeping track of symptoms, and following dietary recommendations are all important. Staying informed and engaged helps patients work effectively with their healthcare team. Diet plays a significant role in managing chronic kidney disease. Patients may need to limit sodium, potassium, and phosphorus intake, and ensure they get enough protein without overloading the kidneys. Working with a dietitian can help create a personalized eating plan that supports kidney health. Regular physical activity is beneficial for people with CKD. Exercise helps control blood pressure, manage weight, and improve overall well-being. It's important to choose activities that are safe and enjoyable, and to consult with a healthcare provider before starting a new exercise routine. Nephrotoxins are substances that can damage the kidneys. These include certain medications, herbal supplements, and contrast dyes used in imaging tests. Avoiding unnecessary exposure to nephrotoxins is important for people with CKD or those at risk. People with CKD need regular follow-up appointments to monitor kidney function, manage complications, and adjust treatment as needed. Consistent care helps catch any changes early and ensures the best possible outcomes. If you have risk factors for CKD or notice symptoms like swelling, fatigue, or changes in urination, it's important to see a healthcare provider. Early referral to a nephrologist can help with diagnosis, treatment planning, and slowing disease progression. Living with chronic kidney disease can be emotionally challenging. Anxiety, depression, and stress are common among patients. Support from healthcare providers, family, and mental health professionals can make a big difference in coping with the disease. Chronic kidney disease can impact daily life, but with proper management, many people continue to lead active and fulfilling lives. Staying informed, following treatment plans, and seeking support are key to maintaining a good quality of life with CKD. Chronic kidney disease is a serious but manageable condition. Early diagnosis, regular monitoring, and healthy lifestyle choices can make a significant difference. Working closely with your healthcare team helps ensure the best possible outcomes and quality of life. To recap, chronic kidney disease is a long-term condition where the kidneys gradually lose function. It's diagnosed through a combination of blood and urine tests, physical exams, and sometimes imaging studies. Early detection and management are crucial for slowing progression and maintaining health. If you or someone you know is at risk for chronic kidney disease, regular checkups and healthy lifestyle choices are your best defense. Stay informed, work with your healthcare team, and don't hesitate to seek help if you notice any symptoms. Your kidneys are vital, take care of them. Thank you for watching this comprehensive overview of chronic kidney disease and its diagnosis. For more information, consult your healthcare provider or visit reputable medical websites. Remember, knowledge is power. Stay proactive about your kidney health.